And we're actually going to be rolling out a program very soon that's going to have evidence-based recommendations, and it's going to be able to be modified to the patient's level of activity.
Welcome to Baptist HealthTalk, a podcast on all things healthcare, powered by Baptist Health South Florida, your trusted source for healthcare prevention and wellness.
Hi, everyone. I'm your host, Johanna Gomez. Welcome back to a new episode of Baptist Health Talk, where we answer your most searched questions on trending topics. Today, we're talking about what concierge medicine is, how it differs from regular care, and how it's giving patients another option when it comes to personalized healthcare. We are joined by Dr. Kathleen Filiaggi, concierge medicine physician at Baptist Health, and Dr. Marissa Mauricio, clinical pharmacy specialist at Baptist Health. It's great to have you both here. A lot of conversation about concierge medicine. So let's break it down. What is it and how does it work?
Concierge medicine, it's an elevated, personalized form of healthcare that can be offered to patients. With our concierge practice, we offer extended, unhurried appointments. We offer 24/7 accessibility, which means during regular business hours, our patients are able to directly call one of our offices and right away be able to have a conversation with one of our well-trained nurse navigators.
24/7?
Yes, ma'am.
Is this open to anyone?
Any
patient?
Yes, ma'am.
Okay.
Any individual who is interested is able to join the practice. After hours, patients are able to reach the physician through either email, text, or phone call.
Wow.
We also alleviate the hassle of scheduling labs and appointments.
Oh, that's a good thing to know, because that can get very, very tricky and frustrating.
Yes. We also offer seamless connectivity with the Baptist specialists. What this means for patients is through our concierge practice, when they have medical concerns, having a relaxed, comfortable environment, being able to thoroughly go through their concerns.
Okay.
There's also the added security of knowing whenever something does come up all of a sudden, or there needs to be a refill of their prescription or whatever medical need, they're able to very quickly speak with their physician or be able to speak with one of the members of our staff. The majority of the patients who have joined, who've participated in our concierge practice thus far, tend to be patients who have very medically complex medical history.
Got it.
Or those folks who prefer the convenience of what concierge medicine offers.
Just being a little easier. So I am assuming that prior to being part of this program, we will have to sit with you, correct? And you'd have to go through our medical records and kind of have a baseline of where we start. It's not like you can just sign up and call and say, hi, I have a headache or whatever I'm feeling.
The process normally starts with scheduling a meet and greet session where we, the concierge physician, meets with the patient, see if it's a good fit. Are they comfortable with us? And we then do some exploration of their health history. If patients are then interested in pursuing concierge medicine, then our wonderful nurse navigators take the process over and make it happen.
I love that you are nodding and agreeing with every word that she says. And as we are aware, life happens, right? Yes. How easy do you and your team make it when it comes to refills? Pharmacy sometimes can get a little, just a little aggravating sometimes to have to deal with that. How easy is it?
Yeah, we try to take the burden off the patient and the provider. We have an automated refill management system, which essentially takes in all refill requests, and we're able to address those in a timely manner. So that way the physician is able to work with the patient directly, and the pharmacist and my support team, we can handle those requests in a timely manner. So I also help with coordinating prescriptions from the Baptist Health Pharmacy. So whether that's picking up their prescriptions at the pharmacy or if they need them delivered or if they're going out of town, we make sure that they get those prescriptions ahead of time. So it makes the process much more convenient to the patient.
So it's kind of like you are always working ahead, thinking of what the patient might need when life throws a curveball at you. Let's talk specifically about women's health because it is a topic, right? All different stages, right, of being a woman, from fertility to menopause to expecting. It changes so much. So as top health concerns kind of arise, what are some things that your team helps to meet those changing needs that we as women need?
Honestly, right now, with my current female population, through my concierge practice right now, the top female concerns that I am seeing deal with perimenopause and menopause. The symptoms of perimenopause, menopause, such as the hot flashes, the night sweats, weight gain, mood swings, and many other symptoms, understandably, are very irritating, bothersome, upsetting to
Those are the
patients.
most beautiful adjectives I've ever heard to describe exactly that.
How to treat these symptoms, honestly, depends on the female patient and her health history. It's a unique situation because each patient is unique themselves, and it's an individualized approach. And that's one of the things with our concierge practice. It allows us the time and the opportunity to spend the time with the patients to thoroughly make sure that all of their concerns about these health issues are addressed.
Yeah, Dr. Mauricio, how do you and your team help with those changes for us to feel confident when it comes to working with you?
We really try to take the patient into the center of the care. So making sure that we're listening to every single concern, making sure they're a part of the decision process as well. That's a really important part. If they are wanting something that's maybe a non-hormonal option to hormone therapy, then I try to stay up to date with new drugs that are coming out that might meet those requirements. There's new medications being approved all the time. And so I have to stay in tune with what's going on in the guidelines. I stay in touch with the reputable organizations like the Menopause Society. So that way we have the most up-to-date information and we're able to provide that evidence-based care to the patient.
And how does your role change in concierge medicine?
Yeah. So as a pharmacist in concierge medicine, we are able to really help the patient directly. We kind of take away some of that burden of having to reach out to the pharmacy and things like that. But I can also provide some personalized care through precision medicine, offering resources like pharmacogenomics and nutrigenomics, which looks at the patient's genes, and we can provide more evidence-based information. And so, like you said, it's more time spent with the patient and really being able to hear what concerns they have and then providing that to them.
Yeah. So let's just say you have a woman in her 40s and, everyone looks different, right? Concierge medicine is not just about calling when you're not feeling well, but just with the evolving changes that come. So you have a woman in her 40s, and how do you personalize her experience and her wellness plan when you go ahead and take her on as a patient?
I have to, first of all, say that I'm very proud of my concierge patients because so many of them already are very keen on being on top of their health.
Okay.
When we are working, though, towards developing a more personalized health plan long-term for a patient, first starts with a very thorough history and physical exam. And then also working with a patient and having an idea, what are their health goals? We also take into consideration the recommendations for preventive health. We assess lifestyle. And then we, if there can be adjustments made to a patient's health style, make recommendations so that they're going to be able to maintain and improve their health.
Yeah.
If there are any underlying chronic health issues, we do also try to make sure that the chronic health issues are being kept under control as best possible. We stay on top of what is needed in terms of the labs and diagnostics. Also, through our concierge practice, we offer gallery testing. It's new. It is a blood test that detects, it's an early screen for detection of cancer. And we also offer full body MRI for our patients. These are extra tests that if patients are interested, we're able to offer to them.
And now, is this something that's only for patients that are part of the concierge medicine program?
Not necessarily, but we do make it easy for them through our practice.
And when I think of concierge medicine, I just said a woman in her 40s, but if the woman in her 40s has little ones, are they part of the plan? Do you see the entire family, or is it just one person?
It is all encompassing. I do admit that a good number of our patients, it's husband and wife. Okay. And I love it.
Yeah, it's great.
Because you'll see them kind of playing off each other a little bit. Okay. But then I also see, because if one's misbehaving, then they make sure that that's not happening. And then also, too, I also see them working as a team.
Yeah.
The husband and wife work as a team in trying to keep healthy.
Yeah, and accountable. And accountable for each
absolutely.
other.
Yes.
Okay, so we all wear these wearable techs and all these things that tell us how we're feeling. How does that change for you guys? And this is for both of you to answer when a patient comes to you and I say, my health tech has now told me blah, blah, blah. How does that change your decision and how you actually take care of us as the patients when we think we know it all because we wear all these wonderful gadgets?
Well, they have been helpful. In some instances, they have been helpful in terms of patients being concerned. They've noticed that there's something going on with my heart rate. And they bring it to our attention. We investigate and we find out there's an underlying arrhythmia. Okay, that device, they weren't having any significant symptoms otherwise, but the device showed that something was happening and was going on. Other devices, such as the continuous glucose monitor that a lot of diabetics are starting to wear, are very helpful for us because it helps us in terms of being able to have more data. We love data. And with the data, it can help us determine what we need to do with medication. But then I've also found with a number of my patients that these types of devices also help patients identify what foods and what beverages that they eat and drink that are causing the spikes in their blood sugars. And then they're more aware. Yeah. Other patients, like with blood pressure monitoring, it's very common that when patients go into their doctor's office and vitals are collected, the blood pressure is high. Now, is that really a high blood pressure or is it just because of the situation of being in the physician's office? So having home blood pressure monitoring as well and having more data related to home blood pressure monitoring to help guide us whether or not there need to be adjustments to the blood pressure medication or patients need to start blood pressure medication. Gotcha. Even a scale, especially for patients who have congestive heart failure and we're trying to monitor their fluid balances, the scale's very helpful. I have found also that patients like this. It's a sense of control and it's being able to do some of this monitoring at home. They love it.
Yeah. Are you a fan?
Yes, I'm a big fan of wearable devices. I think data can be really helpful with insights on what's going on. And like you said, it gives the patient a sense of control and over their own health journey, which is really powerful. And for some of them who are busy on the go all the time, you can get reminders from things like your watch or whatever that is to check in with yourself and really see what's going on. And it can align with their goals. And from a concierge standpoint, it has that remote patient monitoring aspect, which gives us more data. And then we can really look at that and say, how are we going to implement this into your treatment plan? So I'm a big fan of them. And if they ever have questions, they can ask their physician or their team. And we can do some research into the evidence to see, is this a good wearable device and how do these compare?
It's great that we're all talking about the physical wellness, but we also have to talk about the mental wellness as well, which we know is just as important as it is physically. How does concierge medicine help with the wellness side of being healthy and staying healthy?
Yeah. I'm a certified wellness coach, so that's one of the things that I talk about with a lot of the patients, especially if that's part of their primary goal that they want to address. So we really try to incorporate things like supplementation, or if we're looking at anything that's going on from like a mental standpoint. We also look at the physical aspect by seeing like how can we incorporate or how can we give recommendations for physical activity? Do you need to go to physical therapy? Mm-hmm. Do you need guidance with finding a gym, or what does that look like? And we're actually going to be rolling out a program very soon that's going to have evidence-based recommendations, and it's going to be able to be modified to the patient's level of activity. So that, again, gives us more data points to look at, but then also allows the patient to grow in their physical fitness and their own wellness journey.
Can you both share an experience where you have seen concierge medicine help and make a difference, especially in women's health journey?
Yes, I can for sure recall one specific patient, very lovely middle-aged lady who, like so many other patients, unexpectedly was diagnosed with cancer. It was caught early enough and was able to be successfully treated with chemotherapy and radiation therapy, and she is now in remission. Unfortunately, though, she has developed some chronic side effects related to the treatment that she received for her cancer. And because our practice allows us to be able to really spend time and be able to listen to what patients are saying, we were able to help work through how the chronic side effects related to her treatment had an impact on her health issues and also her relationship with her partner. Oh, wow. And I am very happy to say she's continuing to do very well.
That's great. Yes. Good news. Mm-hmm. You have good news to share with us?
Yeah. We had a patient come in. She was also middle-aged, and she was talking about her concerns. She was having some very general symptoms, things like weight gain and fatigue. And she felt very dismissed by some of her other providers that she had tried to speak about this with. And so coming into the concierge medicine clinic, we were able to sit down and really dive deeper into what was going on. We were able to run additional testing, which allowed us to really open up that conversation and dive into the background of what was happening with her. And so she felt very seen, very heard, and it really helped make that relationship much stronger with our clinic. And we see her regularly for her conditions, and she's doing pretty good.
Yeah. Well, you know what? It's not all about the ladies. The men also need some love. Have you seen any progress and help? Because it's different for men. I think sometimes they're like, no, I'm tough. I can handle it. Has concierge medicine helped them on their journey? Do you have a story?
Absolutely. And like we had said earlier, it's kind of, you see the family sometimes. So sometimes the men are coming in with their wives and, they have that little nudge to come in and,
you
check in with the doctor. Yeah. So at first they're thinking, it's really just like, my visit, my check-in to see how I'm doing. But as we start to develop that relationship with the men, they really see the importance of their health and know that they can be more proactive in what they're doing. And once we build that relationship, they feel so much more comfortable with asking questions and saying, I actually experienced this one time, and maybe they didn't think to bring that up before, but we have that strong trust and that bond. Like it's like an extension of the family in a way. And so far, I feel like our men's health patients are doing really well.
Yeah, and I think that probably men would like this because it's just so easy, right? It makes things easier. Yes. You don't have to think about it. It's just picking up a call and saying, I've got you to talk to you. Something is up. Something's not working. Something's not right.
Yes. No, my male patients, very similar to my female patients, are on top of their health. It's different situations because some of my patients are in business. They're very limited on time, but when they need something, they need it taken care of now.
Right away.
Right, exactly. And we're able to do that for them.
Yeah.
But then other patients who have retired, they have a little more time on their hands. They research things. They have a lot of questions. We're able to spend that time with them. But it really, as I had mentioned before, it really is wonderful seeing whenever there is both the husband and the wife or the partners whenever they join together, because they really do make it a team effort, the two of them.
And it sounds like you guys have a great team working on this. I can't wait because I know it's growing.
Yes.
It is expanding.
We do. We have 7, at present, we have 7 concierge physicians over 4 counties, and we're growing.
Yes. Congratulations. Thank you so much. This has been a lovely conversation with both of you. Thank you for sharing your insight and educating all of us here. And for all our viewers at home, be sure to hit that subscribe button on our channel here to keep up with the latest health and wellness information and tips from our experts. Thank you so much for watching, and stay healthy.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.